White House officials are visiting Purdue University to discuss the Biden administration's policies surrounding harm reduction during the newly declared Recovery Month. Our Emily Slater is at the university with more. Emily.
Dr. Rahul Gupta is the director of the Office of National Drug Control Policy. He's the first medical doctor to hold that position. Dr. Gupta and the Biden administration have shifted the office's focus to harm reduction in order to combat the opioid crisis.
The Biden-Harris administration was the first administration ever in the history of U.S. government to embrace harm reduction. That means evidence-based harm reduction, such as naloxone, the drug to reverse overdoses from opioids, fentanyl test strips to make sure people have the ability to check their drug supply for the presence of this deadly drug called fentanyl, which is 50 to 100 times more potent than morphine, and syringe service programs that are evidence-based and are known to prevent the spread of communicable diseases, but also save lives and connect people to the field. So this is really critical.
Locally, the Tippecanoe Health Department runs the Gateway to Hope Syringe Exchange Program, housed inside the Recovery Cafe. Through this program, the county's HIV and Hep C infection rates have been reduced and 18 people have entered into treatment. As a medical doctor and former West Virginia Health Commissioner, Dr. Gupta has personal experience combating the opioid crisis.
One of the biggest things I've seen is the extra regulatory barriers where I could write prescriptions all day long for Lortab or opioids, but when someone came to me and said, I need help, I could not write them a prescription for MAT. For treatment.
Dr. Gupta is using his position to change that.
We've gone from $0 funding in the history of the United States government to the president's proposed budget of $500 million now. We currently have about $400 million that is going into the funding of harm reduction evidence-based practices across the United States.
Dr. Gupta and Purdue are proud to see some of that funding aiding the fight here locally.
This is important because we must meet people where they are in order to save lives and help connect people to treatment eventually.
Emily Slater, Star City News, Purdue University.